Hello everybody. What is the most likely diagnosis on this case study? I will give you some time to answer the question. And the answer is subgaleal hematoma. Let's see how we came to this diagnosis. So first we have to understand what is this image. This is a head ultrasound image. What do we see? We see that there is a collection which is hypoechoic and which is above the skull bones. It is crossing the suture line, and there is some tissue between the bone and the collection, and there is some tissue above it. So based on these information, what are the options? What is the diagnosis? It is subgaleal hematoma because one, subgaleal hematoma is a collection that crosses suture line. It is a collection which is between the periosteum and the subgaleal aponeurosis, also known as the galea aponeurotica. So the answer is subgaleal hematoma. Now let us see how it looks on a CT and an MRI, because the ABR exam is very image heavy and they love to ask diagnosis on different modalities. So we should know all the modalities for each diagnosis. Here again, we can see there is a blood collection which is at a location, though we cannot see the suture, we can see it is at the location where there is a junction of the parietal and the occipital bone here also. So it's likely crossing a suture, and the collection is between the periosteum and the galea aponeurotica. Now we can see that it is not above the galea aponeurotica, and neither is it below the periosteum, and it's crossing the suture line, and so it is a subgaleal hematoma. Now look at the other options. Caput succedaneum. How does a caput succedaneum look? A caput succedaneum is also due to trauma and is a serosanguinous fluid collection which is external to the galea aponeurotica. So on this head ultrasound, you can see that this uniform soft tissue above the bone is the periosteum, but there is some more soft tissue which is not so uniform and thicker. So this is likely not the periosteum, and so the galea aponeurotica, and there is some fluid collection. So that gives us only one option, and that is caput succedaneum. Here again, we can clearly see that this collection is also crossing the suture, but it is above the periosteum and the galea aponeurotica, and here again it is a bleed which is above the crossing the suture line but above the periosteum and the galea aponeurotica. Now I agree sometimes it will be difficult to make out, as in these two cases, and not in the head ultrasound but in the CT and MR, to differentiate between the galea aponeurotica and the periosteum. But well, some of the ABR questions are also dicey, but most likely they will give you an image where you can make out whether it's the caput succedaneum or the cephalhematoma. Now coming to the third option. The third option is where you can see a collection which is just above the bone. There is no uniform soft tissue because the soft tissue is here, and it is a subperiosteal bleed. And here also there is a subperiosteal bleed. Here we can see this is called the double skull sign, which is basically the periosteum has got calcified, and so this double skull sign is seen, which is basically very diagnostic of cephalhematomas. And here again we can see a collection which is not crossing the suture line, and thus it is a cephalhematoma. So the thing to understand is a cephalhematoma will never cross a suture line, whereas a subgaleal hematoma or gallia or caput succedaneum will cross a suture line, at least for exam purposes, they will definitely give an image which is crossing the suture line if they are testing that, because that is how we differentiate these three from each other. So summarizing, a caput is edematous fluid, which is crossing the suture line and is above the periosteum, and whereas a subgaleal hemorrhage is also above the periosteum but below the gallia aponeurotica and is a blood density, and a cephalhematoma never crosses a suture line. So this will help you. I can understand that it might be sometimes difficult in the exams to differentiate this from this because it both crosses the suture line, but most likely they will give you an image where you can clearly make out whether it's blood or edematous fluid, and also you can make out whether the periosteum is the only layer below the collection or the periosteum and the subgaleal uh, the gallia aponeurotica is also there, because then it will be a little more thick and a little more irregular, whereas if it's just periosteum it will be a thin uniform soft tissue. Okay, thank you.